In your health tonight, we're going to talk about something we all love talking about, especially as women, cellulite. It's sort of our worst enemy, yet the reality is a lot of us, even if you work out, have it. So joining me to talk about it is Dr. Sabrina Fabi. Thank you for being here.
Absolutely.
You look great. I would say that you probably don't have any cellulite, but I bet you would tell me I was wrong.
I hide it well. I hide it well, as most of us do, because up to 90% of women have cellulite, and it's a normal condition. And it's thought that it's basically your body trying to create an energy reservoir for pregnancy and lactation.
But there is a difference between women who are working out, say, and maybe have less cellulite than if you're not doing anything. So are there some simple tips people can do to at least reduce it?
It's funny. No matter what, even if you work out, the body doesn't lose fat evenly. And so after puberty and before menopause, you're prone to want to hold fat in the hip and the thigh area. And so even if you try to lose fat, you may not necessarily lose it there.
You're going, what the heck? I keep doing lunges and it's not going away.
Right. And even after menopause, then you start to hold it in your abdomen. And so that's when you can start seeing cellulite in that area.
All right. So I've seen at the grocery store or at the cosmetic store all of these like reduced cellulite creams and rub it on and it tightens your skin. So what really is the true story on what's out there?
I wish some of these creams had a little bit more clinical trials to support their claims. Most of the actual laser and energy devices are going to work the most and the best. But if you are going to go out there and get some creams, you're looking for 3 key ingredients.
Okay.
Retinols are probably going to be the most effective because they've actually scientifically proven to increase the thickness of the dermis and decrease the appearance of cellulite.
Okay.
But other common products contain caffeine, theophylline, and the thought behind caffeine is that it basically shrinks the fat cell, and studies have been shown on mice to actually do that by 25%.
Wow.
And then theophylline has been also shown to decrease the fat cell and thereby decreasing the appearance of cellulite.
Right. Too bad if you didn't drink more coffee, that would reduce cellulite because you have the caffeine.
Right. I wish. I have no cellulite.
Right. That would be amazing. And then talk to me about if someone really has a problem with it and they say, you know what, I can't do the creams, I need to go kind of to the next step. What's out there?
So VeloShape is probably the most effective treatment. It has the largest safety record and has the most clinical trials up to date, showing that when you do biweekly treatments for up to 4 weeks, you can achieve between a 75 to 100% reduction.
And this is the video we're looking at.
And this is the video, and it basically incorporates vacuum, massage, infrared light, so heats the skin gently, basically targeting heat to the fat cell to try to shrink it and increase the metabolism to basically get that fat out there into the lymphatic system, and then aids in the drainage of that fat with both vacuum and massage. And then it also has bipolar radiofrequency energy, which is showing right there, that targets heat into the second layer of the skin, the dermis, to thicken the layer of that skin so that the fat underneath doesn't show as readily.
Right. Very fascinating. All right, Dr. Sabrina Fabi, thank you so much for joining us. And for all you women watching, if you have a little cellulite, you heard it from the doctor. It's totally normal. And with that, Lauren, we'll send it back to you.
So we just can't use a vacuum cleaner at home and hope to achieve the same effects. I'm assuming that's correct. Thank you very much, Dr. Fabi.